Hi, we are Fishnet Analytics, a two-person team, Kyle McCarthy and Tristan Grupp. We have created an opioid abuse risk model to help cities better distribute services. Our first site is Cincinnati, Ohio. In the United States, nearly 30% of patients prescribed opioids for chronic pain misuse them. In 2017, 47,000 Americans died of an overdose, and 2.5 million suffered from substance abuse disorder of an opioid. The yearly economic burden since 2006 has been estimated at $78.5 billion. Cincinnati recorded 600 overdose deaths in 2017. The city convened a panel of medical experts that recommended a 400% increase in naloxone, a drug that prevents opioid death from an overdose. Our question is, to prevent future deaths, how should these doses be best distributed? The city needs to predict where overdoses occur to provide essential services. Our process is to predict high-risk areas for opioid overdose and also areas with long ambulance response times. We then see where existing services locate. Finally, we determine where to distribute new services, such as risk reduction facilities, rehab, and locations to deploy emergency vehicles, all in underserved areas. This application is for the city government. It determines where to put intervention and risk reduction facilities to provide naloxone, clean needles, and support services. It also provides areas with slow ambulance response times. It is a simple and quick tool to use for non-technical decision makers and for quick implementation. We imagine risk reduction facilities to have prevention intervention services such as treatment and counseling referral, naloxone distribution to reduce opioid deaths by up to 21%, and provide clean needles to reduce healthcare costs from diseases transmitted by sharing needles such as hepatitis C and HIV. The areas in green are predicted high-risk areas for opioid overdose. Our prediction is based on a geospatial risk model. The model in this instance found 3 areas with high predicted opioid overdoses: Coreyville and Heights, West End, and over the Rhine and Price Hill. We now look to existing centers, such as hospitals that would provide similar resources that risk reduction facilities would provide. They are yellow points with a 4-minute travel distance, the time in which naloxone should ideally be administered. Areas outside these 4-minute boundaries are underserved and would benefit from risk reduction facilities. Our model can show where a city should locate new rehab facilities as well. We find high-risk areas, far from rehabilitation facilities, and then provide the vacant lots that could be converted into new rehab centers. In addition to locating rehabilitation facilities and intervention sites, we also look to which areas are high risk for opioid overdoses and have long ambulance response times. Reducing response times is crucial for administering naloxone. Some areas in Cincinnati have longer than 10-minute wait times and need to be patrolled more frequently. Here we see areas that are both high risk for opioid overdose and have long ambulance response times. This example shows the overlapping area between 2 high-risk, underserved areas and the vacant lots within them. These lots could be used for a new emergency response facility. We created a grid to capture 2 categories of events: opioid overdose and feature events. Feature events include traffic, downtown distance, and crime, as well as other features. These feature events were compared with the overdose events to see which had the most significant relationship. We used the most significant features to create a model that was run against the opioid overdose data set by k-fold and leave one group out cross-validation. The model predicted overdose events, and then we checked for error to improve the model. Thank you.